you should, because it's 10:59.
And then if you can't see me, it's Gabby!
You're like hip to here. I don't know why.
Can you see me now?
I can see you better, and I can see Gabby.
All right. So we're waiting for people to join. Good morning, everyone. This is Gabby, the newest member of the American Stroke Foundation. Gabby, who's that? Okay. Hello, everyone. I'm going to give Gabby off to Susan. Susan. Gabby's our certified occupational therapy assistant. Whoop, whoop. Okay. Do I need to adjust the camera or anything?
I think you're good.
Okay.
And whoops.
Good morning, everyone. Hi, Shannon. First one to comment. Good morning. This is Muzna from the American Stroke Foundation. Today's Facebook Live Q&A is about aphasia and strategies for communication with family and medical providers. Our live sessions are part of the Stroke Foundation's virtual Next Step program. The Next Step program, the mission of that is to support stroke survivors and their caregivers in the ongoing challenges after stroke. For more information on what we're going to talk about today or anything else related to leading a well life, please visit our website at americanstroke.org. There you'll find links to our Instagram, Facebook, and YouTube channels, and you'll also find a link to our blog. We have 11 viewers. Start saying hi and start sharing your comments and questions. So I'm going to start by reminding everyone that I am an occupational therapist, not a speech therapist. My job is to support participants in anything that occupies their time. So meeting them where they are and helping them make the medical information that they're getting useful for them. So my intention today, just like with all the sessions so far, is to help everyone here connect through their shared experiences, empower everyone joining today to advocate for themselves after a stroke, and to share the insights of the stroke survivors that I have worked with. Hi, Bobby. So aphasia. So aphasia is a language disorder that affects how you communicate. There are many types of aphasia, and diagnosis will be made by a speech-language pathologist after a physician's referral. But for the purpose of today's discussion, aphasia affects your ability to say what you want to say when speaking or writing, your ability to understand what is said or read, or a combination of both. A physician or neurologist will make note of these symptoms after a stroke and refer you to a speech-language pathologist for a comprehensive evaluation. The physician and or SLP provider may also refer you for a neuropsychology evaluation if there are concerns that there are cognitive changes as well. So cognition and language go hand in hand, and we want to make sure that you have a comprehensive workup after a stroke to make sure you get the appropriate care. Hi, Stacy. There are other changes in language that are not aphasia, so it's important to get the right diagnosis. For example, after a stroke, if you have weakness in the muscles of your face, that's going to affect how you're able to make sounds, and that can be mistaken as, aphasia when it's really just related to muscle weakness. So it's important to see the professionals who know what they're doing, okay? Good morning, Linda. Okay, so the first thing I want to say is that you want to make sure that whoever you're seeing is respecting you as an individual after a stroke, right? So just because you're having challenges expressing yourself or understanding, the doctor or medical professional or rehab therapist still needs to be looking at you and directing your questions to you. So an example is like if someone needs translation services in the hospital and a translator comes in, it is still best practice that the person who is talking to you is still talking to the person who needs the translation versus addressing things to the translator. That's not how communication works, okay? That's not a person-first approach. So your doctor, your therapist needs to be talking to you. You are still your own person, and you should be treated as such. So that's number one. No medical care is going to give you the maximum benefit if you don't feel respected and comfortable in the situation. Okay, so Shannon says yes. So I think she's referring to what I just said. Okay, so let's start hearing your questions and comments about changes in your ability to speak, changes in your ability to understand, or as a caregiver, the challenges you've experienced. The goal of today is really just to share the challenges and kind of discuss them together, but also kind of discuss some of the common strategies or information that is given out to stroke survivors and caregivers, and highlight some of the challenges that occur with these strategies, because on paper the strategies seem like, yes, this is what I have a challenge with, and this strategy addresses those challenges. But in real life, the execution of it doesn't seem to work. Why? Why is that not working for someone if it's addressing what their challenge is? And that's kind of what occupational therapy, like at the core, is. You have to make sure that the strategy that looks best on paper, the strategy that's best, practiced when it comes to research, is actually something, number one, that the person understands, number two, that the person wants to use, and number three, that the person feels that, it's related to how they are gauging progress, right? So say if someone is working on memory, right? And you do memory drills and memory drills and memory drills, all the stuff that, you're used to making a difference in those participants. And then you give them a test that you gave them at the beginning to test their quote-unquote memory. And their score goes up 10 points. And you say, hey, congrats, your score went up 10 points. But if that person is still, forgetting their keys in the morning, if their person still can't engage with their caregiver in a conversation about what happened yesterday, those 10 points don't mean anything, because that's not how the person, they're not walking around with a test score on their head, right? What is it that they're having a challenge doing as a result of their symptoms? Is that how they're gauging progress? And how can we tailor the strategies to actually make a difference in that frame of reference? Does that make sense? So some strategies for communicating and or working with someone who has symptoms of aphasia. Number one, you want to make sure you have their attention. Now, attention is a cognitive domain. So if there is, a brain injury and it affects part of the frontal lobe, you're going to notice attention deficits that impact their ability to receive and process information, right? But as we've talked about kind of before, and we're also going to, have a upcoming discussion on kind of what we call sensory preferences, which talks about like when you're sitting somewhere and you are there for a medical appointment or you're there to get care, like everything else that goes around you that you're noticing either consciously or unconsciously is going to affect your ability to learn. So did you hit traffic before you came to the doctor's appointment, right? Are there lights that are too bright for you? Is it really noisy? Are you uncomfortable in your wheelchair? Do you need to go to the bathroom? Are you hungry? Like all those things are going to affect your perception of how the appointment went and the usefulness of the information to you. Because if you're uncomfortable physically, cognitively, emotionally, that's where your brain is going. Your brain is not focusing on the discussion that you're having or your therapy session or whatever. So same with aphasia. Like if you are working with a speech and language pathologist, or you're working with an interdisciplinary team and it's your OT and your speech therapist, if you are not comfortable, if there is something that is making you physically uncomfortable and you're unable to communicate that, that is going to affect your performance, right? So is the participant, the client, the patient, are they prepared to receive and process information? And you can gather some of that information in the initial screening. You can talk to a caregiver and make sure that the person is sitting up straight, that their feet are on the floor or on their footrest, that they're not crooked, that their arm is not dangling, that they're not, having issues with, saliva, or they're, they have their glasses that they're supposed to be wearing. You want to make sure they're set up for success. So that's number one, attention and making sure that everything around you is supporting your performance. So Shannon says, this June is my 10-year stroke anniversary. My aphasia got better with speech language pathology. However, when I'm tired or stressed, my aphasia brain gets worse. It's frustrating. I hoped, whoop, we lost the camera. There we go. Okay. This June is my 10-year anniversary. My aphasia got better with speech. However, when I'm tired or stressed, my aphasia and brain get worse. It's frustrating. I hope that when time passed, I would just get better and better, but that hasn't happened. Thank you for sharing, Shannon. And that is kind of, that is a universal experience, but also common with stroke survivors, that the more tired you are, the later on in the day, affects your performance, even when you're using the strategies that have been proven to be effective for you. And that kind of goes into the stuff that we've talked about prior in the prior Facebook sessions, is like knowing your strengths and setting up your day. So when we do our in-person program at the Stroke Foundation, I'm at the mission site, we talk a lot about that. Like when you are trying to make a phone call to get your transportation set up, when you're trying to schedule a doctor's visit, when are you doing it? If you're doing it at the end of the day when you're fatigued and it just took you, 2 hours to get home on shared transportation, your performance is going to take a lot more effort, and it's not going to be necessarily where you want it. So doing it first thing in the morning, doing it when, the doctor's office is not crammed with people trying to wrap things up at the end. So one of the strategies you can do if you're still seeing a speech language pathologist is you can always touch base and you can say, hey, these strategies work really well, but when I'm tired, I need something like, what are my 2 to 3 like fail-safe, lowest common denominator kind of strategy. And you can also, it's important to show yourself grace, like being frustrated and all the emotions you're feeling are all valid, and recognizing that when you're tired or stressed, performance goes down. That's not, instead of maybe reframing it, that is your body and brain talking to you. And that's great, because sometimes that connection is not there for people. So your brain and body are giving you signals that it's time to take a break, or it's time to reschedule that task, or it's time to delegate. Rest, the need for rest is a sign of health. The need for rest is not a sign of something is wrong with you, because it means every system is in check. If your brain and body just went without any of those signals, you would burn out. Shannon says exactly. So I'm hoping that was related to something I said. Thank you, Shannon. Okay, so make sure you have attention. And as we discussed with Shannon, set yourself up for success. So what is it that takes, what strategy takes the most effort? What strategy is most labor, cognitive intensive, and kind of setting your day up like that. So that, gives I think that also keys into the overall theme of things, which is that, again, strategies that work on paper, and that strategies that work when your cup is all full and your tank is full and you've got that, your reserves are all there. They're not necessarily going to work in every scenario, right? So that's a function of being a normal human being with normal capacity, but that's also, why we're having this discussion, because occupational therapists have a lot of discussions with people about what to do when the strategy doesn't work, or what to do when the strategy doesn't make sense, or what to do when that motivation isn't there. Motivation is a whole nother topic, but we all can point to examples in ourselves where we know what to do and we know what will make us feel better, and we still don't do it, right? So that's not a reflection of us not wanting it. That's a reflection of our emotions getting in the way, right? We're tired of it. We wish we could just communicate like we used to. We just want it to be simpler. We're frustrated. Why can't people be more accommodating? When those emotions and feelings come into play, it's going to affect the effectiveness of any strategy. Shannon says the frustration with Medicare only giving a certain number of speech language visits is valid. Yes. Yep. The number of visits for any therapy, they're not really, they're made by legislators and lobbyists, and they're not being made by therapists, and they don't reflect best practice. So Definitely part of your goals, whether you're seeing a speech language pathologist or any other rehab professional, is to make sure from day one you are preparing for discharge, right? How can I continue this work on my own? How can I continue to find resources that will help me take the next step, right? Your therapist should make you feel empowered from day one. It's always a collaboration. It's not because someone is doing something to you or because they have like the magic touch. It's because it's a collaborative relationship, and anything that comes from them is a reflection of what's coming from you. So it's always, it's always because of your hard work. That being said, there are great resources in your area if you want to look at student training opportunities. So we have a clinic here that in the area that offers OT, PT, and speech by students with clinical supervision. And that's a way for people to continue to get, a little bit more guidance in the appropriate realm, OT, PT, or speech. You could also reach out to local schools in the area and see if they'd be able to offer, clinical opportunities, volunteer hours, or whatever. So there are ways to get more of that, and with everything else, it's up to you, right? You have to be able to advocate for yourself, and that is challenging with aphasia. So getting your team together and making sure that if you are having trouble at a doctor's appointment communicating what it is you want to communicate or processing all the information that is given to you, part of your toolbox. Do I need to take someone with me? Do I need to ask permission to record the conversation? Do I ask for an after visit summary so everything is written down? Tune into yourself and see what it is you need, and then problem solve and work to get that, right? But it's hard to tell someone what you need if you don't know yourself. Okay. Alyssa said, I used to have it in New Jersey until insurance stopped. You're talking about speech language pathology, Alyssa. So one thing you can also do is reach out to support groups in your area and pick the brains of the facilitators of the group and also the other stroke survivors. And they will have, they've walked the walk, so they will have guidance on where you can continue to get support. And working with each other, there's a difference between very concentrated medical setting therapy activities versus getting an experience immersed in real life, right? Where you're having to talk to family, where you're having to interact with the community. I shouldn't say having to, where there are more opportunities to do that in an organic way. Part of the reason that the Stroke Foundation, I think our in-person programs are so meaningful to participants and why they are there for years at a time is because it's a safe environment that they've created for themselves. So it doesn't matter how long it takes to communicate something. It doesn't matter what the different challenges are of the two people involved in the interaction. There's no rush. There's no feeling of self-consciousness. And they've created that atmosphere themselves, right? And that's why we want to kind of build this virtual community as well, so that it's a safe place here, or you guys can share resources of other places where it's okay to be yourself, and as you're being yourself, you're practicing the skills related to expressing or understanding or anything else related to language. But again, that kind of comes back to my first point of are you ready? Have you set yourself up, or has the person who is trying to help you set yourself up for success? Are you ready to receive and process that information? And we do the best when we like the person we're with, when we feel comfortable, when we don't feel judged. Alyssa says Philadelphia has speech language university and also for the deaf. Yeah, definitely. I mean, that would be a great starting point. Just contact your local therapy schools and see what they have to offer. Even if you come in to help students train, you get the benefit of, having the access to those resources. So Shannon said, I wish we had you all in Denton, Texas. I've learned so much from Stroke Foundation Online. Thank you, Shannon. That feedback means a lot, because that is our mission, that is our goal. We're here to support you, and we're here to learn from you. And so in order to make this the most value-added forum, it requires, we need your feedback. What's working, what's not working, what can we do better? Alyssa says saying hi to neighbors is great. Yeah, I think it is sometimes always surprising, and this is true whether you have a stroke or not, that, you know, there are not so nice people, but there are also people who, you know, you're afraid that you're going to be judged, or someone's going to roll their eyes, or someone's going to get impatient, and you'd be surprised. As long as you feel comfortable with it, say hi, make that initial contact. And if it goes great, great. And if it doesn't, it's still okay, because you're still taking that opportunity. So, Shannon said, my husband has two. It's helped us as a couple. That's great. Yeah. Autonomy is important, and a stroke can change us in so many ways that make us feel that we don't have ownership anymore. And when it's language, based, that is even, kind of a bigger crush, because that's how we communicate, that's how we get information. Nonverbal communication is important too, but everything kind of works together. And when you're not able to speak for yourself in a way that feels timely and that feels independent, or when you're not able to process that information, it feels like you're disconnected from things, and it can be easy to kind of retreat into the place where you feel you don't have to interact like that. But like with any other, treating it like a muscle, right? The more you do it, the more your brain gets activated in that area. I think we've maybe heard the term learned uselessness, or learned helpfulness. Sorry, usefulness is the wrong word. Learned helplessness. So if we have an affected arm and we don't use it, then our brain is kind of like, our whole body is mapped in our brain. So if we are not using an arm, then our brain's like, hey, I kind of haven't gotten feedback from this arm, right? And it will send cells there to detect changes of movement and tension and friction. And so when you do move it, it's going to feel extra sensitive and uncomfortable, because your brain's like, hey, SOS, haven't heard from you. Let me send, some troops down there. And then when you do move, because everyone's looking at it and everyone's there, it's more noticeable. But eventually, if you start engaging that arm, as tedious as it seems compared to your strong arm, all those extra cells go away, and that sensitivity goes down. So same with like language. If you are not practicing those skills, and don't put yourself in a situation, don't inundate yourself in a situation where you're completely out of your comfort zone. Start in the smallest place possible that you feel comfortable, with people you trust, and have that conversation. Have that conversation for the purpose of practice, not perfection. John says, we use a boogie board a lot. Verbal with the written word helps us communicate. That's great. What's a boogie board? Alyssa says, I have transcribe app to help communicate. That's awesome. Shannon says, pushing through is sometimes hard, but I know it's important. Yeah. And and this is coming purely as an observer, right? I have not had a stroke. I've only worked with stroke survivors. But with anything, eventually we all have to change the way we do things if we want to stay connected to the things that are important to us, right? Stroke or no stroke, we're all going to get old, and older. And as we do, the way we are able to do things with our brains and bodies change. So eventually we all have to push through things that used to be very easy for us. And then the people who push through end up with different outcomes than the people who kind of retreat into themselves, right? That's why having your village and having supports like the American Stroke Foundation, having a network like this is so important, because you're not alone. Alyssa says, I will Google the board. Do so and let me know what it is. I'll look it up too. Erin says, one of my biggest problems is people protecting me with what they think, not reality. I call it killing with kindness. It's hard to stick up for yourself when people are trying to help, but it's necessary. Yes, definitely. And Shannon says yes. That's why education is so important, right? Caregiver education, stroke survivor education, but also community education. So if you are at a point in your journey where you want to connect with support groups, not as necessarily as a participant, but as a speaker, if you want to reach out to schools, especially for people who are being trained to be rehab providers, do so. Your voice will make the biggest impact because you know where the cracks are, where things are falling through. You know where what you got that was helpful, and you know what you didn't get that made you feel like you were behind. So use your voice if you feel comfortable in that. Become a community participant. Volunteer for organizations that talk to doctors, that talk to hospitals, that talk to the community, that talk to schools, you know, not just rehab schools, but, you know, children, elementary school, high school, that like, hey, you're going to run across people who may move differently than you, who may talk differently than you, and it's okay to have a conversation. And let's keep it going, right? So a lot of schools have in-services with people with service dogs, right? You don't pet a service dog when they're working. Those things used to be new and novel, but now everyone knows that, and kids are more aware of those things than some adults, right? So use your experience to pay it forward. Use your experience to make the, you know, journey for the next person a little bit better. A boogie board. Jane, actually, our executive director, just pulled it up. It's the old magic slate, but it has a button to push to erase. That's great. John says, get it on Amazon. It's great. Did you hear that, Jane? We're going to get it on Amazon. Thank you, John. So when we, and please keep the questions and comments coming. I appreciate them all. So I want to circle back a little bit to strategies and barriers. And so one is communication devices, right? They can be low tech, like the boogie board. I hope I'm pronouncing that right. I don't know if it's boogie board, boogie board. Okay. Or they can be, you know, things on your iPad, or they can be apps and stuff. So again, great strategy, and the technology in that is improving in such a amazing way, but again, it has to be a match for the person, right? Like if you are naturally tech averse, being, you know, shown all these things that are techie is not going to make you feel comfortable. It's going to add another level of stress and anxiety, right? So meet yourself where you are and make sure your provider also knows where you're comfortable, right? Some of the feedback over the years about communication devices, especially ones that, you know, are voice assist, is that the voice sounds robotic, right? People feel embarrassed. It doesn't sound real. And so the last technology conference that I went to, they had a lot of improvements, you know, things that were able to make it more, the voice more lifelike, or even be able to mimic and sound more like you. And you would, you know, to some people that may seem like such a small thing, but for the people where that's a barrier to them using that device, it's a huge thing, right? Like, I am not a robot and I'm not a computer. It makes me feel awkward when we're all sitting around having a coffee and like the computer, you know, is it me they're talking to, or is it the computer they're talking to, or the iPad or whatever? So those are the kind of things that collaboration between other disciplines, in addition to obviously speech language pathology, can make that the device or the aid more meaningful to the person. So that's definitely a huge one. That's the feedback, I think, for the most with communication devices is, hey, you've got it. Why is it always in your bag? Well, it doesn't sound like me. Or the pictures look like cartoons and I'm not a kid. Or it doesn't have the detail that I want, or I kind of never really felt comfortable with it or learned it. It was just kind of like, hey, it's covered, you can have one, and kind of here you go, right? So again, the intention is there and the purpose matches the challenge, but that interface hasn't been nurtured. Shannon says, thank you, John. I've never seen this one, but able to check it out. Yes, thank you, John. I think you've all introduced us to something cool. Stacy said, I've tried playing communication charades, but it becomes frustrating when people can't exactly comprehend. Yeah. So, you know, charades in general, like, you know, it depends who you're playing it with, right? You want to also go in with the mindset of, are you doing this as quote unquote therapy, or are you doing it just for fun with friends, right? Because it also, that affects how you come into the activity, how you approach the activity will also affect your perception of frustration or not, right? Be with people who make you laugh, and try it out, because, you know, charades is kind of a process where everyone messes up, and things are always like off the mark in a way, but it's, you know, that's part of the fun of it, right? So if that's a way through fun, through play, that makes that process of working on your language challenges more approachable and less scary, go for it. John says, I have a WeGo ACD and haven't found an SLP to help me use it effectively. Okay. So John, I don't know if there are online resources or manuals that will help. Lots of games are fast. I need it a little slower. Okay. So maybe just Google that, right? How to slow down the games on WeGo ACD. If there are any speech language pathologists on the call today or on the video today, and you'd like to reach out or put a comment, please let us know. We'll pass it on. But just like with anything, it's not a one-size-fits-all, right? Let us know if you find anything on that. And I haven't heard of it, so I can do some research too, and I can touch base with our speech language pathologist as well. Okay, so another strategy for working with someone, or, you know, communicating with someone with aphasia is using repetition. So obviously with that, something that is, you know, kind of obvious but overlooked more often than it should be is, you know, has a person's hearing been assessed, right? Were they hard of hearing before the stroke? Has the stroke impacted their hearing? Have they been tested? And again, hearing, just like vision, is more than being able to hear things at a certain volume, right? There's also auditory processing. Are you able to take in information when there's background noise and make meaning of it? That is related to hearing, but it's also separate than hearing, with separate testing and separate strategies. So, you know, strategies for aphasia only work if you're looking at the components of that skill, right? Writing down keywords is another strategy commonly used for aphasia, or having visually based supplies, which brings us back to, has their vision been tested, right? Not just eyesight, but their ability to take in the information through their eyes and make a meaningful decision from it. Caregiver education, especially in the beginning, is huge. Our intuitive way of wanting to help is usually wanting to jump in, and to prevent the uncomfortable silence. That's just kind of how we're wired. I think that's one of the hardest parts of also learning to be a therapist, right? After a stroke, the literature on learning how to use your arm again says that the best way is to have the person figure it out themselves. Limit your cues, limit your feedback, you know, sit back and give them time and space without making it feel uncomfortable. But as a new therapist, that can feel very uncomfortable. Hey, I've got this person who's here to do therapy. I've got family looking at me and I'm not saying anything, I'm not doing anything. But that's how motor planning and motor relearning happen. So caregiver education with aphasia, I've had the opportunity to observe lots of speech language pathologists do their initial education, and also recommend that for caregivers, and it's always value added, right? Because it's about separating yourself from wanting to help to what is actually going to help the person receive and process the information to improve performance. Aaron says, I got here late. What is aphasia? So aphasia is a language-based deficit after a stroke. Up to 25 to 40% of people after a stroke have aphasia symptoms, according to the National Aphasia Association. And so it affects your ability to communicate. So either you have trouble saying what you mean to say, like using the intended words to speak or to write, or you have trouble understanding what is said to you or what you read, or a combination of both. So it's a communication challenge. that affects how you communicate. The official diagnosis is done by a physician and speech language pathologist, but after a stroke, that is something that one of the symptoms they screen for. Alyssa says, right now I keep using the wrong remote. Wrong remote, like for the TV, is that what you're talking about? Stacy says, it's not as much as playing charades. When I can't find a word, I will mimic. But it gets frustrating when someone calling out words that are nowhere near what you're trying to say. Yes, I hear that. I hear what you're saying. So what have you tried, Stacy? Let's start with that. What are some things you have tried, or is that something you're doing less often? Shannon says, my husband was able to sit on some sessions with my SLP, as did my middle school kiddo and my high school kiddo at the time. It helped so much. Yeah, it does. Like, no, you know, in addition to having to navigate all these things that are new as a stroke survivor, it's also new for your family. It's also new for everyone who's in your life and a part of your life. And so that education piece is so important to create a situation where everyone is learning at the same time, and to set yourself up that you're going to have that you're going to set up that you're going to set up systems that make everyone feel like they're helping and that they're getting what they need. Aaron says, oh, I never knew that. It makes more sense when I saw the wrong word. I've always done that more since the stroke. Yeah, but I knew what you meant, right? So that's another thing too. Like, you know, when you make a mistake with spelling or saying something, like, not everything has the same consequence, right? Like, if I make a mistake here, and I've done plenty, I've mispronounced words, I've said the wrong word, and if I catch myself, great. If I don't, but the consequence is what, right? That I have to repeat myself, or that you guys want to check my credentials. I mean, you know, like, the consequence is okay. You know, I'm here in a supportive environment. It's a reciprocal relationship, right? Now, if I were, you know, typing or saying something in a formal document and I couldn't hit unsend, that has a bigger consequence. So, you know, learning not to beat yourself up over, like, every single thing is not a reflection, or is not a symptom of your stroke, or a reflection of a you know, of a weakness or a shortcoming. Mistakes happen, and you only want to spend time on the ones that, you know, truly have a consequence that matters to you, versus, you know, here, if I mess up, I mess up. I'm human, right? Shannon says, they really started to understand my frustration. Yeah, you know, there is, in school, we used to do this exercise where, to help understand the experience of someone with a visual change, we would walk around our campus with glasses designed to mimic different visual changes. So either a neglect, or, you know, you're not able to see at the left side of your eye, or your periphery is blocked, or you have tape on the middle of your glasses and you can't see the middle of where you're walking to. And obviously it's not the real experience, but it does make you, it gives you just a glimpse of how things that are so easy for someone without a vision change is so hard. So every task that makes us feel like, oh, I don't want to do it, or this is going to take so long, add a vision change to that, and it's just that much more, right? So definitely education with aphasia is really important too. And as much as you can help someone, you know, walk a mile in your shoes, or kind of see that, you know, everything just has an added layer of complexity, not just with the stroke, but with aphasia specifically. John says, keep trying. My wife says what I have to say is important. Yeah. I mean, you know, there's an adjustment period, but eventually if you put work into it, you will have a toolbox, and it will be more automatic. It won't be something that takes so much time and so much attention, but you do have to put the work in on the front end to have that toolbox. When do I need someone with me? When can I take my you know, communication boards, whether they're on paper or on my iPad? What can I do online at my own pace? What do I have to be on the phone for? What can I delegate? What can I have in my pocket to quickly pull out and let someone know that, hey, I have aphasia and it may take me a second, but I am here, you know? Not everyone is comfortable with, letting people know that, and that's okay too. You don't have to disclose what you're not comfortable with. You just need to have 2 to 3 go-to strategies that you feel comfortable with, that you feel confident with, and that you feel satisfied with, to help you navigate your day. And then just like with everything else, there are going to be things that pop up. There are going to be challenges that you didn't anticipate, and that's okay. It's a learning opportunity. And at the same time, it's okay to be frustrated. It's okay to be sad. It's okay to have a day where you're feeling angry about things. It's not mutually exclusive. You can still actively be working on things and have strong feelings about things. Shannon says, John, your wife is right. Yes. Things would be a lot easier if everyone knew that. Wives are always right. I'd save a lot of money with OT referrals, The amount of times I've heard, oh, my wife said that. I'm like, yeah. Shocker. Your wife is always right. Okay. Shannon says, I lost vision in my left eye. Man, oh man, it's been hard, but we adjust. Now I'm losing vision on my right eye, so new adjustment. I'm hoping to find resources for vision loss and blindness. Yeah, new adjustment. I like how you framed that. I'm sure it may have taken a bit to frame it that way. But you can Google low vision clinics in your area. There are also occupational therapists who are trained as low vision specialists, so they can also give you guidance. If you're not sure about that, you can always Google vision rehab and they'll refer you to the right person. John says, does the American Stroke Foundation have a card to say I have aphasia? Yes, we do, and we will make sure that is posted here. Thank you for asking. And this, I ran this card by our speech language pathologists that graciously volunteer their time at the American Stroke Foundation, and they said it's still like the best practice card. So it has been vetted by speech language pathologists, and I'm happy to share it. Thank you, John, for asking. Stacy says, I've gotten to the point that if I have a doctor's appointment, I try to write down questions or concerns beforehand so I don't forget. Absolutely, fantastic strategy. Again, showing a strength. You've identified an area that you can do something about and you're implementing it. That's great. That's a great strategy for everyone. There's so many times that you have a limited amount of time with someone and, leading up to it, you have all these questions, and in the moment, you're focused on hearing what they're saying, or it was a stressful time to get there, or you're thinking about what you have to do next, and things, you're like, oh man, I forgot to ask this, I forgot to ask that. So writing things down is awesome. Sometimes I even, if they have online portals, submit the questions in advance. It doesn't mean that they're going to see them or use them, but, I do it, so. Aaron says, there's vision therapy. No one told me until 3 years after my stroke. It is very helpful. Yes. So a neurooptometrist or an optometrist. So neurooptometrist is not a formal type of optometrist. It just means that optometrist who has done their fellowships and extra training in the area of neurological changes. They can refer you to vision therapy. So you do need either an ophthalmologist, but more often an optometrist referral. And then the vision therapy is done by occupational therapists or someone who's been trained as a vision, for vision therapy. It is very helpful, very life-changing. Can be a little uncomfortable in the beginning, but again, it's your brain adjusting to doing things in a more energy-efficient way. Work smarter, not harder, so well worth it. Shannon says, how can we get the card? We will post that card and figure out a way to get it on our page. Shannon says, great strategy, write or type all the time. Absolutely. Shannon says, yes, I'm going to an optometrist end of June. Great. I wish people, even doctors, would look at me in conversation. I can understand. Yeah, I mean, and that's why that was the first thing I said, right? Your doctor, your practitioner, your rehab therapist, they need to be looking at you. They need to be directing their questions to you, regardless of who and what device or person you're using for assistance. And however you want to convey that, you do it. Whether you want to have your spouse or caregiver, say that and leave the room, whether you want to have that on a card, whether, you want to make sure the nurse knows beforehand. Absolutely. It's getting, that education is always something that can be more robust for medical professionals who are not in rehab, is how to actually talk to someone when the interaction is not the traditional way that we're used to. Because usually it's not ill intent or malice directed, it's just people don't know any better, and they're uncomfortable. Great questions, everyone. Thank you so much. So kind of last call for questions and comments. So next week, our Facebook Live will be on Wednesday instead of Thursday, because we are going to do a live stream for our exercise class at our mission location. So it's called Morning Muscle Moves, and it is a chair and standing based exercise class that works on balance, your affected side and your unaffected side, and really just works on head to toe movement and stretching. So we thought it'd be great to share that with you, and we hope you join us and participate in getting your body moving. If you have any questions about the movements, please let us know. It's one of our most popular programs in terms of how many people engage and how people focus and hone in on their goals. And so it'll be facilitated by 2 occupational therapy students, and then we'll have students helping out individual participants with their leg or their arm or their balance. So that'll be next Wednesday at 11 Central. We hope you join us, and we'll send out, we'll put a Facebook post on that. So that'll be Wednesday instead of Thursday next week. Okay. Thank you, everyone, for your questions and comments and for your recommendations. We're going to order a boogie board. I'm very excited. So take-home message is, just like with everyone else, you are the expert on yourself. You know what's working for you, you know what's not. And so setting up a system where you can convey that to the person you're seeking support from is where you start, right? No one should be telling you how it is. They should be working with you. Okay. Thank you, everyone. We will see you next Wednesday for Morning Muscle Moves. Take care.